Hello and welcome. How we talk about our state of health or suffering has a massive effect on how we exist in those states. In this interview, I speak to two researchers from very different backgrounds who have come together to help people living with persistent pain using a type of body awareness practice known as somatic practice. Emma Meehan has a background in theatre and now works at the Centre for Dance Research at Coventry University. And Bernie Carter started her career in nursing and developed an interest in children living with pain. Bernie now works at the Faculty of Health, Social Care and Medicine at Edge Hill University. So we covered some really key topics about patient-practitioner relationships, including the use of phrases such as wear and tear, which, as Bernie explains, may lead to patients being cautious and moving less when actually their healthcare provider may be wanting them to move more. Also, we talk about the importance of people regaining ownership of their recovery, exploring how their body moves in new ways and finding new meaning for their situation or their suffering. I really hope you enjoy this interview, and please subscribe to the Inner Sense channel for more of these conversations. Thank you very much. So maybe we could start by hearing how you both came to work with each other, a little bit about your career backgrounds and why you decided to collaborate on the topic of chronic pain.
Well, my background is actually in theatre, so but I was always very interested in movement, and I ended up doing my PhD about an Irish choreographer, and she did kind of outdoor site-based performance work and attending some of her training. And then at that time, I didn't know it was called somatic practices, but we did things like authentic movement, a lot of kind of improvised movement, and then looking at the developmental movement patterns of children and all sorts of things like that. And then did my PhD around that kind of work and came to Coventry, where there is a centre where they do a lot of work around somatics. But I was really interested in the health side because I found in looking at this choreographer's work, it was kind of bridging the creative and the therapeutic. So I talked to various friends in health. So I have a good friend who's a physio, works in chronic pain. And also Lisa Dowler, who's a colleague who works with children who live with pain. And through Lisa was introduced to Bernie. So that's how we got to know each other, and that's how that started. Yeah.
So there's a few things I'd like to ask about what you just said. But first of all, maybe if I can hear Bernie, your career background and how you ended up specialising in this area.
Okay, so my background is children's nursing. Kind of born and bred, I think, a children's nurse. And within children's nursing, one of the things when I very first started, which was back in the mid to late 70s, pain relief was really poor for children, mostly because there either wasn't the technology around for children, or we just didn't have analgesics that were appropriate for children. So kind of it was a little bit of a baptism of fire for me becoming a children's nurse and seeing children experiencing pain. And although we've got a lot better, we now assess pain better, we've now got a lot of interventions that we can use, and we've got technology that we can use, there's still an awful lot of children who live with chronic pain where there aren't services available to support them. And a lot of the time, as with adults with chronic pain, even when they see specialists, the case is, well, you're going to have to learn to live with it. And then there are some options given or some exercises given, but it doesn't really address things like the meaning of pain or how you can live a good life with pain if that's what's going to happen. So although a lot of the research that I've done has been to do with assessment, it always feels like it only goes so far. And what we need to do is have opportunities of where we can send people, what we can do. And part of being a children's nurse and being a researcher working with children is you tend to be creative. So we use a lot of different creative methodologies, play, movement, a whole range of different things. And as I guess I'm coming towards the end of my career, I'm using the opportunity to get in touch with lots of people that are doing things differently. So it's kind of like a mind expanding thing for me, which I, as somebody who's reasonably well known in the world of children's pain, I can take some of these ideas back into health and start to create some persuasive arguments as to why we need to think more widely than we currently do. Because even the most enlightened of us are nowhere near as enlightened as people that come from a very different position. And I'm not saying that we accept every new idea that comes along. You need evidence. So when I was put in touch with Emma, it was lovely. And like I say, like Emma says, we were put in touch through Lisa, who works with children at Alderhay, which is where I also do some of my work along with the university. And it felt like a safe introduction to a person who became a very safe person. We sort of co-explored, because I was the novice when it came to somatics and movements and some of these creative things. And I was able to sort of introduce people to sort of why health professionals think differently or may reject some of these ideas because it's just not the way that we've been educated, or the mind lines that we think along.
Different worlds, different language, different kind of completely different perspective of the relationship, how relationships begin with the people we're working with. So great that you've had an opportunity to find, to bridge those different disciplines and different worlds. Could we start with maybe a few definitions? So I'm familiar with the word somatics, but I notice hopefully we'll talk about your paper in a little while and some of the collaborative research. But for the layperson, what does somatics mean and somatic practice? And then the third one, I was interested when you from your introduction, Emma, authentic movement. So
wow, good question.
Maybe starting with somatics, what does somatics mean in your worlds?
Okay,
Is it for each of you?
So basically, the network is an exploration, bringing people together from different backgrounds. So I think we spent a lot of the time trying to figure out what exactly somatic practices were and how you explain them. So I could talk about like my perspective, and you can tell me, would a lay audience understand this? And maybe Bernie can chip in and what you think it is now. So for me, the fundamental thing is connecting your body and your mind. So some people are understand that from mindfulness practice. You might follow your breath. So your thinking mind isn't wandering somewhere else, but you're focusing, you're bringing your attention to your body. And that's just, I think, deepened further in somatic practices where, it might be that you're very aware of your hand touching the wall, or you're moving through space, or other things like that. So awareness, reflection while in movement. And I think that the felt experience is really important. So it's not just objectively observing someone and their movement, but actually trying to understand what someone experiences as they move. So that's really important. And that's also a way of giving people, empowering people to say, I'm the expert in my own body. So once I train myself to become really aware of my own body, I know the points where I'm holding tension, or I'm holding my breath, or my preferences and how I might change those. And then that's another element, is becoming aware of habits and then asking yourself, do I want to try other things? Can I open up the possibilities of my movement? Mm-hmm. And that might include some play, so trying different things. Like, for example, if you're someone, when you walk into a room, you like to stay close to the edge. What happens if you walk through the center of it? And so that element of play, I think, is important to me as well. So I don't know, Bernie, if that sort of covers some of the things, or What would your perspective be on that?
I think the way that you described it is the way that I have now come to understand it, because it was a really slippy term for me to begin with. And it took me a little while to kind of get an understanding of it, and to be able to think of it as something that I could share with other people in a way that didn't feel too hippie or too kind of out there. Because I think when we've looked at it, we've come up as a mindful awareness of your body, but kind of like all elements of your body, and the notion that your mind is attached to it, which is something that isn't always considered within more traditional sort of health services, where the focus is on the bit of the body that is actually causing a problem. And I think the other thing with somatic practice is it's not a case of trying to necessarily fix something. It's trying to sort of draw attention in a different way, or to change the meaning of whatever it is that's causing that person problem. I think one of the queries that we came up with to begin with was I had to go back and look through, I don't know, some of the literature and talk to some of my friends, because somatic is just not a word that we use within health and pain. By and large, the time that somatic will come up with pain is when we use it in conjunction with psychosomatic. It's not used very often these days, but it's not a word that we've got much of an attachment to. I went and checked the large PDF of the recent World Health Organization guidelines on chronic pain, and somatic just doesn't come up. It's not in any of the diagnostic categories, and things like interoception are absent from most of the literature that is guiding medical and or nursing or health service, more traditional health service practice. There is evidence of these sorts of terms being used within some of the more enlightened chronic pain services, but even then I think they're kind of still used cautiously. So some of our conversations have been, how can we actually talk about the same thing in a way that will have meaning to our various sort of audiences? Because talking about somatic practices just raises more questions than it actually answers if you're going to try and sell the idea to people who would be very happy to consider something like yoga or Pilates. But if you label them as somatic practices, it kind of changes the conversation. And sometimes you just need conversations to be short and the messages to be really clear. So it's been really interesting.
And this topic of the language and trying to convey something powerfully, but in a short and concise way, I think is so important, because using I'm just bringing to what comes to mind is physiotherapy here. So you can go to a physiotherapist for pain and be given an exercise to do, which is essentially movement. But that sounds very different if you're following a kind of painting by numbers exercise to what I hear you talking about, Emma, which is for the person to own their movement and to explore and discover and be curious and work things out themselves, rather than thinking someone else is telling me what I need to do to fix something. So, really, they're both movement approaches. Physiotherapy exercises and somatics are both movement-based approaches. So in your seminar last month, I know you were very careful with the language you were using to talk to people about their experience of pain. You mentioned that, and I seem to recall someone making a comment about phrases like wear and tear. Have you come up with any insights that might be useful for people about if they're going through some healthcare service around pain, what to look out for that may help them build a different relationship with pain or their experience of pain?
I think a lot of the conversations are driven by the clinicians, rather than necessarily being driven by the person who's attended to get help or advice or information. And the clinical language that is used, it's kind of something we sometimes call chart talk, because it's our shorthand for being able to make explanations. And sometimes when clinicians are trying to make information available to a layperson, they use lay language, which actually isn't reassuring at all. It can set up issues. So the example, I think it was me that talked about how wear and tear can actually send up warning signals to somebody. Mm-hmm. It's not a particularly accurate explanation of what the clinician is trying to explain. And if you think your joint is suffering from wear and tear, your natural thought is, well, I'm going to protect it. I'm not going to use it too much. I don't want it to wear out anytime soon. And actually, maybe the advice the clinician is giving or the health professional is giving, is keep moving it. So I think there's an awful lot that needs to be done in terms of giving the people presenting more of a chance to explain what their priorities are, rather than them just being considered as a defective knee or an arthritic shoulder or something, so that then conversations could become more goal focused towards what those people actually want, and not to be driven by their language, but to follow the language cues that they give us, rather than us to sort of dominate those conversations.
Yeah, and I think I've learned a lot during the course of the network around that, the kinds of language people prefer. And I actually have found Twitter really good, because I follow a lot of people who kind of are pain advocates, like people like Pete Moore, and just learning a lot about the frustrations people have about language. For example, the word sufferer, like putting you in some kind of victim position and wanting to be, someone who lives with pain, and especially also there was kind of dialogue around whether people wanted to call it chronic or persistent, because chronic has all these negative connotations that persistent mightn't. And, all these debates around language and people, feeling they wanted to challenge the kind of existing language that's being used as well. And then the other bit for me around language is so the kind of movement practices I've been kind of studying, articulating your experience, that's really important. So it's through the movement exploration that you deepen your understanding of your own experience, and then you're able to articulate that to others. So rather than the language coming from outside, it's like you're developing it through your own understanding of your body, and finding ways of describing it and coming to know it better. So that's a way I hope the movement practices are also useful in helping people to find language that works for them, that helps them to identify and explain. Could also be to family members what's going on for them as well,
Lovely. Yeah. I often liken it to becoming a wine connoisseur, and I tell my clients that I'm not a wine connoisseur. I'm rubbish when they all taste the same to me, well, pretty much. But a good, someone who really enjoys wine and is a wine connoisseur will be able to detect the subtle notes and use colourful language and textures and terrains and to really describe what they're experiencing. It's finding ways to be true to your experience and to be able to express that. Is that what we're saying?
Yeah. And you asked earlier about authentic movement, and I didn't respond to that, but it's a movement practice which is very much about witnessing your own experience, so that you move, but you also are able to reflect on what you've experienced, and that involves kind of a structure around writing as well, to deepen your understanding of the felt experience. But it doesn't mean, the title doesn't mean you have to be like there's one kind of authentic and there's another that's inauthentic, which always makes people feel really intimidated if they start moving, going, am I inauthentic?
Like doing it right or wrong, yeah.
Yeah.
Okay.
I think one of the things that's that's perhaps important is that when people have pain, the questions that people ask are kind of really limiting, like where is it, how bad is it, when does it happen? And actually things that are more important to people are like making sense of it. And I think the somatic practices allow people to make meaning out of their pain, so that it's not always something that is terrible and bad and difficult and negative. It might not be something that you necessarily want in your life, but it gives them some sense that they've got a level of control or some level of ownership, because quite often we talk about pain being in the body as if it's something that's totally separate. And I think with the way that somatic practices get people or facilitate or encourage people to think it's part of them, and it's not just the body, it's linked. And I think that way people have more sense that they can work with it or walk alongside it, rather than it just being something that's dragging around the whole time.
Okay. Yeah, it gives them back some sense of ownership. And yeah, what the point you made about the meaning, I think for me is really powerful as well. I think it was some psychotherapy research looking at trying to find a core of how all these different approaches work. And the proposal in this paper was that it was transforming the meaning around something is common to a lot of healing or recovery processes. I think they identified 3 qualities. One was to feel like their situation had been heard authentically. The other one was that they were given a plausible or a valid explanation for their suffering. And then I can't remember what the third one is now, but they were likening it to the placebo effect, not in a negative way, but in a powerful way, really.
Yeah. And I think that being believed is really, really important, because typically people are disbelieved in terms of their pain experience. If you've got a broken leg, people will know that you're in pain and will do something about it. If it's because pain is largely invisible or hidden because of potentially the stigma that can be related to that, people aren't necessarily encouraged to tell their stories. They're not necessarily encouraged to make meaning of it.
So there seems to be some, you've identified some limitations there in the way that that pain and healthcare come together. You've co-authored a paper together, Moving with Pain: What Principles from Somatic Practices Can Offer to People Living with Chronic Pain. Can you please is it possible to summarize some of the main points from what you learned in that the review process?
I think what we were trying to do, just coming towards the end of the network, we wanted to bring together some of the ideas from the different perspectives that we'd encountered. So, what in pain management are seen as kind of key priorities, and how does that relate to research that's done around somatic practices and pain, and what's missing, those sorts of things. It seemed like, there's a lot of different things that maybe I found out while I was doing it. So I'll try to think what's important. One thing that I learned, which I think is maybe relevant to this, is, I had this idea of interoception being the cure to all or something, and I realized during the network and the reading that actually it's sort of actually more about modulating attention. So like interoception, it's not just about getting all of this, being really attentive to everything, because some people, if they're experiencing a lot of pain, that could be very overwhelming. So it's actually about finding ways to kind of modulate that. So for example, we played a bit with like shifting attention in the body away from the site of pain to find other resources or places that felt good, or shifting the tension out of kind of internal body awareness, if that's becoming too much, into attention to the environment or moving through space. So I found that really interesting. That was kind of a new insight I learned in the process. Yeah.
So it's not all about bringing the attention inwards and just being about being aware. And yeah, I see people experiencing overwhelm if that happens too much. Bernie, anything from the or the collaboration?
I think one of the things that we noticed was that there weren't a huge number of studies that we could actually look at. The studies that we looked at had got, I mean, every study's got a methodological flaw. There's a problem in the way the research was done or designed, and that's just the way that research of this sort of nature is, because it's complicated and difficult. But with those ones which were kind of like people with health service backgrounds and academics with health service backgrounds or health service orientations, there was very little involvement with somatic practice experts. So people were using interventions, but not having those interventions driven by somebody who'd got a real lived expertise and history of working with kind of like somatic movements. So that in some ways what you were getting was a very lukewarm version, diluted version of what a therapy might be. The therapies themselves, when they were talked about, were not defined terribly well. So you might have a label, but you didn't really know exactly what was being done within that intervention. So it was hard to know whether or not it could have worked, it would have worked, whether or not it was a good version of, say, yoga. You know, just said that yoga, so you had no real idea whether or not the type of yoga, the amount of yoga, so the sort of the dosage of the intervention was never really clearly described. And I think from our network discussions, actually co-designing a project between somatic practitioners, dancers, movement practitioners, people from health, what we want as outcomes, or what we see as being good outcomes from a research study that would show that the intervention had worked, are very different. So and it's not that they are unable to align, it's just that philosophical starting point is so different. So for health, it's a case of, you know, whether or not pain intensity's gone down, whether or not people are taking less medication, whether or not the number of working days has gone up, which would potentially be of much less interest to a somatic practitioner who would be not wanting to measure anything at all. And we've had interesting discussions where, like, what measurements should we be using? What is the value of a number in relation to somebody's experience of their body? So in terms of the review, I think it became a starting point for an evidence base to show that more research is needed. It certainly, I think, needs to be more collaborative. And we need to think more about what outcomes are of interest to the people who we're trying to help and support. So, you know, in kind of health language, that would be patient-reported outcomes. You know, I want to be able to pick up my grandchild, rather than I want my shoulder to be able to go through a full range of movement.
Right. Yeah.
I want to be able to do this. I just want to be able to go out without worrying about my pain, sort of thing. So I think the research is at its starting point, and I think the network has been instrumental in starting some of these conversations that are necessary.
Yeah. Just on that point about, you know, what the aims are, say, of a research study, like I was following on Twitter, you know, and some people were discussing, you know, being told that yoga or Alexander technique would fix them, and, you know, that being a negative experience because then you feel responsible for doing something to fix yourself. And I thought that's really sad because, you know, from my point of view, if you have a good facilitator, it's actually about listening and responding, exploring. So I think in some ways it's really not valuable to do research that's limited in how it measures what somatic work does, because then you end up with these studies that say, yes, and that fixed this amount. And then someone just thinks, oh, well, when they hear yoga or something, oh, people say that fixes everything, but, you know, then that doesn't make me feel good. And, you know, I think obviously it's really important to have health research working alongside arts-based perspectives, which will show different ways that these practices work as well, so that there aren't misconceptions about some of these practices as well, and what they do and what they purport to do in the world as well. And I think, you know, they won't be for everyone as well. You know, the hope is that it's useful to some people, but there'll be people who prefer other things, and that's fine too, you know.
I think it's much more multifaceted, you know, whereas if you think about maybe a typical, if there is such thing as a typical physiotherapy intervention, it's a case that the patient being asked to do a particular type of movement that is very prescriptive or very fairly regimented and fairly assigned for that particular condition or presenting symptom, which would be very different to the way that somatic practitioners seem to work, which is follow what feels right for you and then work out why it feels right and what you've learned from that and how you can perhaps either extend it or limit it. I mean, I was desperately wanting to try and do it right the whole time until Emma and other people were going like, that isn't a completely, you know, that isn't right. And I was thinking like, oh, slight panic there. I should be moving right, or I'm not a dancer, I can't be doing this, or everybody's going to be better at moving than I am. And I think, well, actually, I do move most of the time in my life. So you come with different expectations, I think, as somebody that, you know, to all of the therapies that are available, and it's mind opening, I think.
What have you enjoyed most then, Bernie, with your own kind of experience of these new practices? What did you find enjoyment in any of them?
Yeah, absolutely. I mean, I felt very self-conscious to begin with. I'd see that I'm very, I think a lot about things, and I think about my body some of the time. But it's a very simple exercise that Emma led, where we were just touching our shoulder and then moving our hand over a period of time down our arm, and asking us just to think about what we were feeling. And although I could probably quote the muscles and I could sort of work out, you know, what vessels were there, I hadn't spent any time actually just being in contact with my body and working out which bits felt squidgy and which bits felt bony and which bits feel, I don't know, wrinkly. So just some of these, the taken for grantedness that your body is more than just the bit that you see and the bits that aren't working. And I think most of us that day had got neck ache from something, you know, and you're just feeling it and you're going like, yeah, okay, well, I do know what it feels like when the neck is tight. But then just sort of exploring the bit next to it that isn't tight. And I'm going like, I wouldn't normally do that. I'd just be focusing on the bit that's wrong. You know, so seeing stuff in context and seeing the body as something has got depth. And it connects. And there's bits of me that knows that, but it gives you permission to slow down and think, actually, I don't really know that as well as perhaps I could do.
Yeah, we've got
that very embodied bit.
We've got the nursery rhyme, the knee bone's connected to the thigh bone.
Yeah.
You know, we know that everything's connected, but experiencing that when, you know, faced with an issue like shoulder pain and noticing that maybe my pelvis, the relationship between the movement in my pelvis and my shoulder, and exploring and feeling those relationships and experimenting with what happens is very different, isn't it, to knowing it knowing it intellectually.
Yeah, and to be fair, I think before I experienced somatic work, I wouldn't have been very aware either. I would have seen my body as something that did things, you know. I didn't really understand that you could sense, and that could inform how you acted in the world. So that was a learning curve for me when I encountered somatics as well. Like your lived, felt experience counted, you know. So yeah, and I think that's basically what interoception is about, isn't it?
Mm-hmm. Yeah, my understanding has deepened through the recent research program and developing that with Dr. Jane Aspel, and then tying it together with the work on the sort of the cognitive neuroscience around emotion as well, and trying to link emotion to the parts of our nervous system, our autonomic nervous system, and then so it's really just bringing together all these areas of science that work separately and all these different disciplines that are really, they're all studying very real phenomena, but seeing how they relate to each other and how they they make sense of how we are as humans and how we communicate with each other. You talked, I liked that Bernie, you said that the introduction to Emma felt very safe, and that's a topic that comes up a lot for me in pain research and pain when I'm dealing with clients, that being able to foster a sense of safety and what that feels like in the body and how that influences pain versus some kind of being in a situation where we feel threatened. Any comments on that? That kind of how a person's general state in life may affect pain, and how we may be able to use movement and somatic practices to guide that in a different direction.
I think how you feel emotionally and where you're kind of like your life circumstances are enormously important, and sometimes they can get forgotten as being factors that people could support or attend to, or just think like, don't worry about it. There's a lot of people that get very stressed about things, and you think like, well, actually, really, I mean, I had the same thing myself where I was getting worried about things, and somebody said, well, what is the worst thing that could happen? And as somebody that can catastrophize like crazy, I was going like, well, actually that. And they said, is that much of a worry? And I went, well, probably not actually. And it's not like everything was perfect after that. We don't talk, people in pain don't talk, are not given opportunities to talk to people or to talk about those things that are of concern. So I think conversation and communication with people is really, really important. And saying it's reasonable to be frightened if you're in pain. Don't suppress it. It's reasonable to be angry if you're in pain. But what would work for you to try and make those things different or better? Sometimes just breathing is fantastic. I mean, we do a lot of breathing in somatics. We're busy running from one thing to the other a lot of the time, and actually just stopping and breathing is kind of quite a powerful thing, even if people go like, I haven't got time to do all that breathing stuff. It can genuinely set you up for the day.
Yeah. And I think what I was reading as well about pain, so the relationship with things like stress and anxiety and depression, it's like a vicious cycle, isn't it? It's what's causing what, so but I know myself, if I'm stressed, I feel pain, and the thing is, the pain might have been there, but I mightn't have noticed if I was relaxed. Whereas if there's a lot going on, then I'm suddenly like, oh yeah, I can feel my neck and I can feel my back and all of those things. So I don't know. I think there is research around your perception of pain also increasing when you're stressed. So yeah, I think they're all really interlinked, aren't they?
Yeah, that's my my experience. And
we know that children's pain is more. Sorry.
Oh, carry on.
No, I was saying we know for definite that children's pain experience is heightened if their parents are stressed.
Mm.
And there's kind of like, the notion of sort of like that feedback loop. Mm. And the difference, I think, with somatic practices is that they don't necessarily talk about stress or anxiety. In perhaps, you might be asked whether or not you are stressed, in a more traditional approach to pain. Are you stressed? How anxious are you? Are you depressed? And then you've got all of that kind of like measured and scaled. And then, well, if you were less stressed, you might have less pain, but actually without giving you the tools to actually deal with that. Whereas somatic seems to not label things in the same way. Mm. So you might be stressed, and the exercises that they're doing or the movements that they might be doing might actually make you feel less stressed, but it won't be the function of the exercise. Or it won't be labelled as that, like we're going to do this breathing exercise and at the end of it you're going to feel less stressed. Because, you can sometimes start there, and if you don't feel any less stressed at the end of it, you feel you've failed the exercise.
Which adds to the stress.
Yeah.
The pressure. Mm.
Yeah. I think a lot of people with chronic pain can feel like they're constantly failing.
Yeah.
Mm. Yeah. And as you say, Emma, it can get into a vicious cycle, and it's how do we enter into that cycle and start to slow it down, and then hopefully reverse it in another direction. It's going to be different for each person, and because the very point you made, I think, which it has to be, or there's a great opportunity in it being an experiential thing for them.
Yeah, I think just kind of a memory, because we have kind of a sister network in New Zealand, and they invited us to a workshop, so we were participating online. And I was stressed at work and my neck was sore and everything, and they were doing kind of Maori based movement explorations, and I did feel the pain surprisingly start to melt away. And at that point, I think it was because it was just that space that was created. When your everyday life, things can feel so compressed. Mm-hmm. You're running to things and you have the next thing and your breathing is getting held. And it was actually just the sense of release, space, giving time, openness, those kind of qualities just made everything sort of drop a bit, So I think that's part of it, is that the time you give to people, the space to explore outside of their kind of everyday life as well,
I'm just aware of the time. That's a great point for me to ask one more question, which is for anyone who is dealing with chronic pain, or I like the phrase that one of the phrases you've used, that when pain returns, so the return of pain, what would be your favorite suggestion, or one suggestion of where to begin a journey with this type of approach, somatic practice? What's a good starting point?
I think probably the first thing I would say is that, instead of feeling you have to jump into doing something, is to actually allow yourself to give yourself a break, because I think that adds to the stress, doesn't it, if you feel you have to resolve it as well on top of everything else. So I think that's important. And I don't know, Bernie, what do you think?
I mean, Pete Moore talks a lot about pacing. It's kind of like the one thing that he thinks people need to learn is to pace. And I think maybe it's not necessarily somatic practice, but I think it arises from that notion of mindful awareness of your body, is think of the successes that you've had in the past. Because I think when pain returns, it can be an overwhelming feeling like it's bad again, it's bad again, it's going to be bad again, it's going to be bad again, we're back in this. And actually, for those people, and some people will live with persistent pain persistently, and it's just never goes, but they will have had success where it was pushed into the background before, and maybe learning from their successes, even if they're tiny. So not to always, in the same way that somatic practices often ask you to think about a part of your body that isn't in pain, then that attention to a good part, a part of your body that you can trust to not be a pain focus, can actually mean that you can sort of think about that. So if your shoulder is really bad, think about your hand or your foot or your toe. And that seemed to have worked within the sessions where people, on the webinars and things, where people have said that they do spend too much time thinking about the bit that's in pain, or the whole, and not thinking about those parts of them that aren't, and liking their bodies. I think you can feel that you don't like your body very much sometimes if you've got chronic pain.
Some really, really, really wise suggestions there, I think, or suggestions based on your experience of working and helping people. So thank you so much for your time. Where can people find out more about your work or your collaboration or the network? What's a good place for people to find out more?
Well, we're on Twitter and Facebook, and we have a website. It is called somaticandpain.coventry.domains. So yeah, that's where a lot of our information gets shared on there as well.
What's the Twitter group called?
Well, you find the link on the actual website, but let me see if I can quickly get it. Our Twitter handle is at Somatics and Pain.
At Somatics and Pain.
Yeah.
If you Google somatic practices and chronic pain, you'll find us normally on Google. Yeah.
Oh, and we have a webinar coming up as well about moving pain online. So that might be interesting to people on the 16th of July.
16th of July, brilliant. I'll share that as well. Thank you very much for your time, and I look forward to finding out more about your work as well.
Thank you. Thank you for interviewing us.
It's been a pleasure. Thank you.
Thank you.